Hey guys, this is Stephanie Lawson. I am from Trenton, Georgia, up close to Chattanooga, Tennessee. I'm going to be talking to you guys today about foreign object in the eye. A little about what a foreign object in the eye actually is. This simply means any object that enters the eye from outside the body. This could be anything from a dust particle to an eyelash to a sliver of wood to even a shard of metal. In other words, it's anything that does not naturally belong in the eye. A foreign body typically affects the cornea or the conjunctiva of the eye. The cornea is the protective covering of the front of the eye, and the conjunctiva is the mucous membrane that covers the white of the eye. People at higher risk include certain jobs such as yard workers, construction workers, machinery workers, sawmill workers, farmers, especially if they're not wearing protective glasses or goggles. But in reality, anyone can get something in their eye at any time. 3 key questions to ask would be, do you have any visual changes? Do you have any eye pain? And do you know what you might have gotten in your eye? Asking these questions are really important to knowing the severity of the problem and what we're looking for. For example, it may warrant an ER visit, especially if it's something that we can't handle in the clinic, or maybe it's more than what we can handle in the clinic. 3 key physical components. The physical exam components would include a Snellen eye chart. We want to especially assess the visual acuity. Another component would be inspect and assess the eye especially from the side, looking at the dome of the eye. Doing this, we can sometimes see if there's anything stuck in the eye. You want to also flip the eyelid, looking underneath the eyelid for any foreign object. The 3rd exam component we can use is a fluorescein eye stain test with a blue light. This is done by applying an orange stain to the eye and then using the blue light. You're looking for any foreign object or any abrasions. Treatments and outcomes. Of course, removal of the foreign object is of course the goal. Use of antibiotic ointments or drops. Ointments really are a better option most times because the ointment retain their antimicrobial effect way longer than the drops, and most abrasions heal or at least improve within 24 to 48 hours. The top 3 teaching components, especially if you suspect infection, you want to make sure to teach your client or your patient to wash their hands before and after putting in any eye drops or ointment to control infection. And then you also want to teach them to do not rub the eye. This prevents further damage or scratches or abrasions to the eye. Sometimes people can even put on an eye patch over the affected eye, basically to protect the patient from scratching or rubbing at that eye. And the 3rd most important teaching component would be always wear protective eyewear when performing any kind of high-risk tasks.